4 common chicken diseases: causes, symptoms, treatment, prevention. As a chicken enthusiast, small backyard farmer, or commercial poultry franchise owner, one of your top priorities is keeping your birds happy and healthy. You may very well be versed in some of the common diseases and conditions that affect chickens and be able to treat those yourself. But what do you do when a chicken gets a disease you don't recognize or don't know how to treat? There are 4 types of diseases and conditions that are most likely to strike your birds. Diseases related to metabolism and nutrition, infections, parasites, and behavioral concerns. With so many different types of chicken diseases and conditions, there is bound to be a time when you are not sure what to do. Here are some of the more common chicken diseases, how to recognize them, and tips for treatment. Coccidiosis. Coccidiosis is one of the most common parasitic chicken diseases. According to livestock feed company, Bentoli, coccidiosis causes damage to the walls of a chicken's gut through the destruction of intestinal epithelial cells. Coccidiosis is one of the most common chicken diseases because all birds carry some strain of the disease, although not all birds will contract it. One of the most serious dangers of this condition is that it can also exacerbate other conditions, or even lead to worse chicken diseases. Chicks are also more prone to contracting the disease than adult birds since they have not had time to build a strong immune system. Contraction of coccidiosis. The disease is initially contracted through the consumption of a parasitical single-cell organism or oocyst that is spread via spores. Coccidiosis starts with an oocyst, or microscopic egg, that is passed through a chicken's droppings. The egg may lie dormant for some time before it sporulates. This allows the parasite to begin a life cycle and continue to multiply. As the parasite takes over, the intestine's healthy functions are compromised, causing a number of both visible and non-visible symptoms. Symptoms of coccidiosis. The most common symptom of the disease is blood or mucus in chicken droppings. However, you should be aware that there are both other chicken diseases and other perfectly normal reasons why a chicken's droppings might appear red or reddish-brown. Other very common noticeable symptoms of coccidiosis include loss of appetite, diarrhea, and weight loss. Weight loss will occur due to the bird no longer wanting to eat, diarrhea, and because they are not able to absorb some necessary nutrients. If you notice that your chickens have unkempt or ruffled feathers, pale combs or skin, or a general sense of fatigue or weakness, these may also be signs that coccidiosis is present. Treatment for coccidiosis. Treatment for coccidiosis can be a fairly simple matter, especially if you catch the condition early enough. A sporulated oocyst is often consumed through contaminated or water. The parasite may also be picked up when a chicken scratches the ground to find worms and insects. When consumed, the oocyst will make a home in the chicken's gut by attaching itself to the intestinal lining. Coccidiosis is treated with the antiprotozoal Amprolium, commonly sold under the brand names Amprol and Corid. This medicine for chicken diseases can be administered through food or water. However, since coccidiosis does cause a lack of appetite, you may need to manually administer the medicine to your chickens orally. The good news is that with quick treatment with Amprolium, and by treating your entire flock, you can usually cure an outbreak of coccidiosis fairly quickly. It should only take around a week to fully eradicate the condition.
Fowl cholera is one of the more highly infectious chicken diseases that can be a risk to your birds. According to the MSU extension, this condition, also transferred through a parasite found in chicken droppings, is so easily spread because, unlike some chicken diseases, it does affect many other species of birds. All of the following can carry and spread this disease from species to species: chickens, turkeys, pheasants, pigeons, waterfowl and sparrows. This disease causes infection of the respiratory system, joints, small intestine, liver and spleen. It may also cause pneumonia-type symptoms resulting from infections in the ears and lung. Contraction of fowl cholera. Fowl cholera is contracted through the intake of a bacterial organism called Pasteurella multocida. These bacterial cells are non-motile, or, in other words, they do not spread via spores and are not able to move on their own. The disease can also be spread through the remains of other dead birds, including the non-poultry species listed above. The MSU extension reports that studies suggest other animals, including pets and wild animals, may also be able to spread the disease to chickens. Further, the bacteria that cause fowl cholera can be transmitted via transfer from shoes, equipment or tools. Because fowl cholera is one of the chicken diseases more likely to be contracted by older birds, it very rarely affects chicks. It is also more likely to be contracted by roosters than hens. Symptoms of fowl cholera. Some birds may not be visibly ill before they die. But many chickens who suffer from this illness will show signs like disinterest in food and water, diarrhea, swollen wattles and combs, swollen joints, difficulty walking, lethargy and stupor. The bacteria generally enter the body through the mouth or via the upper respiratory tracts. Pasteurella multocida parasites are probably most commonly consumed through contaminated food and water sources. Some birds with fowl cholera may produce a discharge from the nose and eyes. An unkempt appearance, such as ruffled and dirty feathers, may also be a sign that fowl cholera is present. Some birds may also drop dead very suddenly. Treatment for fowl cholera. Prevention is the only real cure for some chicken diseases, including fowl cholera. The best prevention methods involve a detailed sanitation routine. Since the cause is bacterial, preventing damp patches and other moisture buildups in coops and yards will help prevent the disease. You can also disinfect the coop, nesting boxes, perches, food and water receptacles and toys regularly. Just be sure to use disinfectants that will not harm your birds. Keeping rodents and wild birds out of your chicken habitat will also help to prevent fowl cholera. Be sure that extra food is kept in a secure area and set mouse and rat traps where necessary. You can also treat your chickens with bacterians whether they are ill or not. These can work to prevent the disease and to lengthen the life of infected chickens. However, you should be aware that to completely eradicate the infection, the only solution is the population of your flock, since neither bacterians nor antibiotics can fully cure the disease. After the population, be sure to thoroughly disinfect all areas and leave them empty for several weeks before adding new birds.